Steps and technique of counseling. Which of the following best describes the counseling process? Option: a rigid set of steps that must be followed in exact order, a continuous systematic professional help given to individuals, a one-time intervention to solve immediate problems, a process that only applies to adults facing life challenges. Answer of this question is option B, that is a continuous systematic professional help given to individuals. Next, counseling is needed. Option only during adolescence and adulthood, exclusively in old age, at different stages of life, including childhood, adolescence, adulthood, and old age. Only when an individual is facing crisis. Answer of this question is option C, that is at different stages of life, including childhood, adolescence, adulthood, and old age. The importance of understanding the counseling process includes all of the following, except of some: guiding the worker in forecasting probable future scenarios, setting objectives and organizing perception, developing realistic and optimistic expectation, guaranteeing a fixed outcome for all clients. Answer of this question is option D, that is guaranteeing a fixed outcome for all clients. Which of the following is not a potential benefit of counseling? Option: improving personal skills, developing greater confidence in academic or work performance, guaranteeing financial success, improving communication with others. Answer of this question is option C, that is guaranteeing financial success. The counseling process is typically described as option a one-way communication from counselor to client, an active process both during and outside of sessions, a passive experience for all the client, a short-term intervention with immediate results. Answer of this question is option B, that is an active process both during and outside of sessions. How many counseling sessions are generally needed to resolve difficulties? Option 1 to 2 sessions, 4 to 8 sessions, 10 to 12 sessions, 20 or more sessions. Answer of this question is option B, that is 4 to 8 sessions. In transactional analysis counseling, which of the following is not a part of an individual? Option: parent, adult, child, teenager. Answer of this question is option D, that is teenager. What is the primary role of counselor in the counseling process? Option: to make decisions for the client, to give direct advice on what should be done, to facilitate the client's own decision making process, to solve the client's problem for them. Answer of this question is option C, that is to facilitate the client's own decision making process. Which of the following is not a basic step in the counseling process? Option: gaining recognition for skills and experience, benefit confronted from a caring position, re-experiencing relevant events from the past, ignoring emotional responses to the past event. Answer of this question is option D, that is ignoring emotional responses to the past events. Effective leaders use a counseling process that consists of how many stages? Option 3, 4, 5, 6. Answer of this question is option B, that is 4. Which of the following is not a stage in the counseling process used by effective leaders? Option: identify the need for counseling, prepare for counseling, conduct counseling, evaluate the client's personality. Answer of this question is option D, that is evaluate the client's personality. What is the primary goal of counseling? Option: to solve all of the client's problem, to enhance the psychological well-being of the client, to provide medication for mental health issues, to create dependency on the counselor. Answer of this question is option B, that is to enhance the psychological well-being of the client. Which of the following is not a part of the general counseling process followed by counselor? Option: background information collection, identification of core issues, case formulation, personality assessment. Answer of this question is option D, that is personality assessment. What is the purpose of the initial interview in the counseling process? Option: to diagnose the client's mental health condition, to discuss the client's concern and explore alternative services if needed, to prescribe a treatment plan, to determine the client's intelligence quotients. Answer of this question is option B, that is to discuss the client's concerns and explore alternative services if needed. Which of the following factors does not influence the length of treatment in counseling? Option: the severity of the problem, the motivation of the client, the type of problem, the client's socioeconomic status. Answer of this question is option D, that is the client's socioeconomic status. Which of the following is not a technique that counselor may employ to help clients understand and their feeling? Option: listening without interruption, giving space to explore thought and feelings, asking reflective questions, providing direct solution to problems. Answer of this question is option D, that is providing direct solution to problems. What is the imposition of a counselor's values and beliefs on the client? Option: it is an essential part of counseling process. It should be done subtly throughout the session. It should be avoided. It is necessary for effective treatment. Answer of this question is option C, that is it should be avoided. Which of the following best describes the nature of counseling process? Option: static and unchanging, dynamic and progressive, linear and predictable, circular and repetitive. Answer of this question is option B, that is dynamic and progressive. What are the three major stages in the counseling process? Option: assessment, intervention, and follow up. Intake, treatment, and discharge. Developing, work in, and terminating a relationship. Explore, action, and maintenance. Answer of this question is option C, that is developing, working in, and terminating a relationship. Which of the following is not a variable affecting the length of treatment? Option: the severity of the problem, the motivation of the client, the type of problem, the counselor's preferred theoretical approach. Answer of this question is option D, that is counselor's preferred theoretical approach. Which of the following is not a step in the procedure of counseling process? Option: establish a safe, trusting environment, help the person put their concern into words, active listening, prescribe medication for mental health issue. Answer of this question is option D, that is prescribe medication for mental health issues. What is the primary focus of counseling? Option: diagnosing mental health disorder, enhancing the psychological well-being of the client, providing quick fixes for life problems, analyzing childhood experiences. Answer of this question is option B, that is enhancing the psychological well-being of the client. What is the counselor's role in the client's decision-making process? Option: the counselor should make decision for the client. The counselor should provide direct advice on what to do. The counselor should facilitate the client's own decision making. The counselor should avoid discussing decision altogether. Answer of this question is option C, that is the counselor should facilitate the client's own decision making. Which of the following best describes the concept of confidentiality in counseling? Option: all information is shared freely with anyone interested. The counselor treats all clients' information as confidential material. Confidentiality is only maintained for certain types of information. Confidentiality is not important in the counseling process. Answer of this question is option B, that is the counselor treat all clients' information as confidential material. Which of the following is not a potential option after the initial interview in counseling? Option: no further counseling is required. Further appointments are needed. Alternative services are appropriate. Immediate hospitalization is necessary. Answer of this question is option D, that is immediate hospitalization is necessary. What is the central goal of all counselors regardless of their theoretical approach. Option to diagnose mental health disorders, to provide medication for psychological issues, to assist the client in increasing their sense of well-being, to solve all of the client's problem immediately. Answer of this question is option C, that is to assist the client in increasing their sense of well-being. Which of the following is not a focus of different counseling approaches? Option behavior, thinking, emotional aspects, physical appearance. Answer of this question is option D, that is physical appearance. What determines the effectiveness of counseling? Option the counselor's educational background, the client's financial investment, how the process of counseling happens, the number of sessions attended. Answer of this question is option C, that is how the process of counseling happens. Which of the following is not a stage in the broad counseling process? Option rapport establishment, problem identification, goal setting, personality restructuring. Answer of this question is option D, that is personality restructuring. Which of the following is not a component of transactional analysis counseling? Option understanding personality, analyzing relationships, examining communication patterns, exploring past life. Answer of this question is option D, that is exploring past lives. What often happens when people start the process of counseling? Option they immediately solve all their problems. They begin to experience a recurring pattern in their lives. They become dependent on the counselor. They abandon all their previous beliefs and values. Answer of this question is option B, that is they begin to experience recurring patterns in their lives. What would be the duration of counseling? Option it should always be a lifelong process. It has a fixed duration for all its clients. It does not go on forever and has an end. The duration is solely determined by the counselor. Answer of this question is option C. That is, it does not go on forever and has an end. What is the ultimate goal of counseling in terms of client empowerment? Option to make clients dependent on counseling services, to provide continuous support throughout the client's life, to help clients find tools to enable them to think, feel, and behave as they desire, to change the client's personality completely. Answer of this question is option C, that is to help clients find tools to enable them to think, feel, and behave as they desire. Which of the following is not a factor that counseling can help improve? Option decision making skill, personal confidence, career direction, physical health. Answer of this question is option D, that is physical health. What is the role of the client's personal commitment in the counseling process? Option it is not important as long as they attend session. It is crucial to an effective counseling process. It is only important in the initial stages. It is less important than the counselor expertise. Answer of this question is option B. That is, it is crucial to an effective counseling process. What is the counselor's approach to the client's values and belief? Option the counselor should impose their own values on the client. The counselor should avoid discussing values and belief. The counselor should not impose their own values and belief on the client. The counselor should always challenge the client's values and beliefs. Answer of this question is option C. That is, the counselor should not impose their own values and belief on the client. What is the primary focus when the counselor listens to the client? Option judging the client's decision, imposing their own interpretation of events, allowing the clients to explore their thoughts, feeling, or behavior, providing immediate solution to problems. Answer of this question is option C. That is allowing the client to explore their thoughts, feeling, and behavior. Which of the following is not typically considered one of the core conditions for effective counseling as proposed by Carl Roger? Option empathy, unconditional positive regard, congruence, analytical interpretation. Answer of this question is option D, that is analytical interpretation. In the initial stage of counseling, which of the following is most crucial? Option challenging the client's belief, establishing a rapport and trust, setting long-term goals, implementing behavior change techniques. Answer of this question is option B, that is establishing a rapport and trust. The continuous the counseling technique that involves repeating the client's word back to them, often with questioning intonation, is known as option paraphrasing, reflection of feeling, mirroring, active listening. Answer of this question is option C, that is mirroring. Which counseling approach emphasizes the importance of core belief and automatic thoughts in shaping behavior and emotion? Option person centered therapy, cognitive behavioral therapy, psychoanalytic therapy, gestalt therapy. Answer of this question is option B, that is cognitive behavioral therapy. The technique of empty chair is most commonly associated with which therapeutic approach? Option REBT, solution focused brief therapy, gestalt therapy, narrative therapy. Answer of this question is option C, that is gestalt therapy. In counseling, confrontations refers to option aggressively challenging the client's perspective, pointing out discrepancies in the client's thought, feeling, or behavior, arguing with the clients to prove a point, terminating the counseling relationship due to lack of progress. Answer of this question is option B, that is pointing out discrepancies in the client's thought, feeling, or behavior. The counseling technique that involves asking the client to imagine and describe their ideal future scenario is known as guided imaginary, miracle questions, future pacing, temporal projections. Answer of this question is option B, that is miracle question. Which of the following best describes the concept of transference in counseling? Option the counselor's emotional reaction to the client's redirection of feelings from a past relationship into the counselor, the process of transferring skill learned in therapy to a real life situation, the transfer of responsibility from the counselor to the client. Answer of this question is option B, that is the client's redirection of feeling from a past relationship onto the counselor. Which counseling technique involves asking the client to rate their feeling or experiences on a numerical scale? Option quantitative analysis, scaling questions, emotional inventory, numerical therapy. Answer of this question is option B, that is scaling questions. The concept of unconditional positive regard is most closely associated with which therapeutic approach? Option cognitive behavioral therapy, psychoanalytic therapy, person centered therapy, rational emotive behavioral therapy. Answer of this question is option C, that is person centered therapy. In counseling, reframing refers to option changing the physical environment of the therapy room, presenting a situation or experience on a different, often more positive light, restructuring the client's entire belief system, reformulating the counselor approach to treatment. Answer of this question is option B, that is presenting a situation or experience in a different, often more positive light. Which of the following is not a typical step in the process of systematic desensitization? Option creating a fear hierarchy, teaching relaxation technique, gradual exposure to feared stimuli, rapid immersion in the feared situation. Answer of this question is option D, that is rapid immersion in the feared situation. The counseling technique that involves asking what else to encourage the client to elaborate is known as probing, clarification, amplification, exploration. Answer of this question is option A, that is probing. Which of the following best describes the concept of counter-transference counter-transference in counseling? Option: the client's emotional reaction to the counselor, the counselor's emotional reaction to the client, the process of countering negative thought with positive one, a technique for reversing maladaptive behaviors. Answer of this question is option B, that is the counselor's emotional reaction to the client. The motivational interviewing, which of the following is not one of four processes. Option engaging, focusing, evoking, confronting. Answer of this question is option D, that is confronting. The counseling technique that involves summarizing and reflecting back the emotional content of client's message is known as option paraphrasing, reflection of feeling, active listening, emotional mirroring. Answer of this question is option B, that is reflection of feeling. The counseling approach that focuses on helping clients identify and challenge their core beliefs is option psychoanalytic therapy, gestalt therapy, cognitive therapy, humanistic therapy. Answer of this question is option C, that is cognitive therapy. Which counseling technique involves asking the client to act out different part of their personality or conflicting aspect of a situation? Option role reversal, psycho drama, behavioral rehearsal, cognitive restructuring. Answer of this question is option B, that is psychodrama. In the context of counseling, what does Soler stand for? Option summarize, often listen, empathize, reflect. Squarely, often posture, lean forward, eye contact, relax. Silence, observation, listening, empathy, reflection. Summarize, observe, lead, explore, respond. Answer of this question is option B, that is sit squarely, often posture, lean forward, eye contact, relax. Which of the following is not a typical stage in the counseling process? Option assessment, goal setting, intervention, indoctrination. Answer of this question is option D, that is indoctrination. The counseling technique that involves helping clients identify and challenge their automatic negative thought is known as thought stopping, cognitive restructuring, mindfulness, free association. Answer of this question is option B, that is cognitive restructuring. In Gestalt therapy, what is the primary purpose of the here and how focus? Option to avoid discussing the past, to increase awareness of present experiences, to predict future behaviors, to distract from painful memories. Answer of this question is option B, that is to increase awareness of present experiences. Which of the following best describes the concept of resistance in counseling? Option the client's conscious effort to oppose the counselor, a natural part of the change process that protect the client from perceived threats, the counselor's inability to connect with the client, a sign that therapy should be terminated immediately. Answer of this question is option B, that is a natural part of the change process that protect the client from the perceived threat. The counseling technique that involves asking the client to imagine the worst possible outcome of the situation is known as option catastrophizing, negative visualization, worst case scenario analysis, uh, data-strophizing. Answer of this question is option D, that is data-strophizing. Which of the following is not a typical goal of the initial counseling session? Option establishing a rapport, gathering client information, explaining the counseling process, achieving significant behavioral change. Answer of this question is option D, that is achieving significant behavioral change. The counseling approach that focuses on helping clients find meaning in their experiences is option existential therapy, behavioral therapy, cognitive behavioral therapy, psychoanalytic therapy. Answer of this question is option A, that is existential therapy. Which counseling technique involves asking the client to keep a record of their thought, feeling, and behavior? Option journalizing, journalizing, self-monitoring, cognitive mapping, behavioral tracking. Answer of this question is option B, that is self-monitoring. The concept of unconditional self-acceptance is most closely associated with which therapeutic approach? Option person-centered therapy, cognitive behavioral therapy, rational emotive behavioral therapy, psychoanalytic therapy. Answer of this question is option C, that is rational emotive behavioral therapy. In counseling, the technique of amplification refers to option increasing the volume of counselor voice, exaggerating a client's statement to increase awareness, using electronic device to enhance hearing, expanding the scope of counseling sessions. Answer of this question is option B, that is exaggerating a client's statement to increase awareness. Which of the following is not a typical component of exposure therapy? Option: gradual exposure to fear stimuli, relaxation technique, creation of a fear hierarchy, punishment for avoidance behavior. Answer of this question is option D, that is punishment for avoidance behaviors. The counseling technique that involves encouraging the client to continue talking by using minimal verbal and non-verbal cues is known as active listening. Minimal encourages verbal tracking, silence. Answer of this question is option B, that is minimal encourages. A counseling technique that involves deliberately exaggerating or acting out a problematic behavior to increase awareness is known as role playing, behavioral rehearsal, paradoxical intention, exaggeration technique. Answer of this question is option C, that is paradoxical intention. The counseling approach that focuses on helping clients identify and fulfill their basic psychological needs is Maslow hierarchy therapy, needs based therapy, choice theory, fulfillment therapy. Answer of this question is option C, that is choice therapy theory. Which counseling technique involves asking the client to identify and challenge their cognitive dystorism, awesome, thought stopping, cognitive restructuring, mindfulness, fear association. Answer of this question is option B, that is cognitive restructuring. In the context of counseling, what does frames stand for in belief interventions? Option: feedback, responsibility, advice, menu of option, empathy, self-efficiency, focus, effort, assessment, motivation, exploration, summary, feeling, reactions, action, motivation, experiences, solution, formulation, reflection, analysis, modification, evaluation, stabilization. Answer of this question is option A, that is feedback, responsibility, advice, menu of option, empathy, self-efficacy. In dialectical behavioral therapy, what is the primary purpose of the wise mind concept? Option to achieve a balance between emotion and reason, to assess represented emotion in memories, to develop psychic abilities, to override the subconscious mind. Answer of this question is option A, that is to achieve a balance between emotion and reason. Which of the following best describes the concept of immediacy in counseling? Option: the urgency of addressing a client's crisis, discussing the here and now of the counseling relationship, the speed at which the counselor responds to the client's ability to make quick decisions. Answer of this question is option B, that is discussing the here and now of the counseling relationship. The counseling technique that involves asking the client to act as if a desired change has already occurred in known as option role reversal, behavioral rehearsal, as if technique, future projection. Answer of this question is option C, that is as if technique. Positive technique. Which of the following is not a typical component of mindfulness based cognitive therapy? Option: body scan meditation, thought suppression exercises, mindful breathing, observing thought without judgment. Answer of this question is option B, that is thought suppression exercises.